look over my orders. I know I'm doing thermal. I know that we're gonna have to position her on her belly. We're gonna have to make sure she has the flat back. We have the towel to go between her skin and the drum, and we're turning the intensity up until she feels that mild warm sensation, and then that's where we're going to leave it. It's the same with the other ones. You're going to leave them with a call button. You're going to give it 5 minutes, come back and check, and when you come back to check, you're going to lift the drum, you're going to move the towel, you're going to look at the skin, you're going to ask her, you know, is it too warm, palpate the area. And when we're doing these lab tests, I want you to pull all the things that we know. This isn't a really good example. The back's not really a good example for what I mean. But say you're working on a frozen shoulder with this. We'll get to the checkoff in just a second. I just want to go over a couple things with y'all for these lab tests. So you're working with a frozen shoulder. All right, if this is my patient in your lab test, I want you looking at the range of motion. So you're feeling it. Okay, I want you to back your arm as far as you can. Okay, now we're going forward. Now, does any of this cause pain? All right, I want you to really palpate the area. Feel it. Feel the back. Where would you palpate? You know, what are we looking for? I know that there's a lot of diagnoses at frozen shoulder. We haven't got there yet. That's this fall. But I know you're seeing a lot of diagnoses that, you know, that may, right, and that's okay, but you do know where it's at on the body though, right? And you know all the motions that these joints and these muscles make, all their actions, right? So that's what we're looking for. I want you to tell me that. I want you to, okay, can you move your foot like this? Can you do it like this? All right, now which does it hurt worse when you go up or down with your foot? Okay, so you're asking there about plantar flexion, dorsiflexion. You're looking at it, you're feeling it. When we get to the other stuff, you'll start applying resistance in that area. You know, I don't expect you to know everything right now, but I do want you to get hands-on and actually look for these things. Make sure that when you do dermatome tests, there is no clothing in the area. You can't tell if they can feel it or not if there's clothing in the area, right? So you have to say, okay, can you roll your sleeves up? Or I would ask them to put a gown on if their clothes wasn't appropriate for me. That way I could get it done. And we do remember how a dermatome test goes, right? So it's close your eyes. We're gonna go unaffected. Let me know if you feel it or not. We're gonna go affected. Let me know if you feel it or not. We're gonna go both sides. The eyes are closed, and I want you to tell me if it's the same or if it's different. All right? I'm just trying to think of a few other things that I had. When you are treating for extensibility, when you're trying to increase extensibility, you want to put the patient on a stretch, especially if it's saying that they want you to put the patient on a stretch. So like with ultrasound, we talked about plantar fasciitis and how you would want them on a stretch when you're treating the area, because as the tissues heat up, they become more extensible. So they're starting to stretch already. And if you're putting them in a position where gravity is working with you, or that it's easy for you to come in halfway through the treatment and give it a gentle stretch, and then, you know, work harder after the treatment, or towards the end come in and work a little harder, then it's gonna help overall increase how much extensibility, how much range of motion you're gonna get this treatment. Does that make sense? All right, so I know it's a lot, but we want to add in all those things, and I know y'all haven't taken a lab test in a while too, so I mean, we're kind of getting back in the groove of all that. But just make sure that you're paying attention to what you're treating for, so you know best ways to position. All right, I think that might be it. Okay, and we're rolling. Let's see if this baby's heating up. Oh yeah. Oh yeah, I see it now. It is heating up though. All right. We'll scoot this on back some. All right, so I got my unit warming up. I'm gonna greet and ID my patient who has had a muscle strain in her lower back. So, hi, my name is Sylvester. I'll be your PTA today, and your name is?
Libby Smith.
And date of birth?
4/30/98.
All right, can I check that real quick? And we're checking the band. That's cute, like those. So you had a back injury a few weeks ago, and you're still in a lot of pain for that. Have you ever tried any type of heat therapy or hot packs or anything? Diathermy? You ever heard of that? Okay. So the way that it works is we have this drum here behind you, and it's a deep heating. So you're going to get to deeper tissues than what you would if we use the hot pack. And the hot pack gets a little heavy sometimes, so it's going to be sitting right on top of your skin. There'll be no extra weight put on it, so you'll just get that deep warmth. It's going to bring a lot of circulation into that area. It's going to help warm those tissues up, and you're going to become more flexible and hopefully relieve some pain while we're at that. Okay, so then we're going to move into our contraindications, which are, I mean, basically a lot of what we done last week, right? The acute inflammation for the continuous mode. Fever is a new one, but cancer, active bleeding, cardiac insufficiency, very young or old, circulation problems, metal in the area, pregnancy, all of those are ones we've had before. We're just gonna have to think about x-rays and pacemakers. X-rays, that makes sense, right? We don't wanna have any of those done within the last month. And then epiphyseal plates of growing bones and a neural stimulator. Those growing bones, yes.
Paula needs to speak to me real quick.
Uh-huh.
I'll be right back.
Okay.
You good?
Mm-hmm.
Okay.
Oh, wait. I turned the timer on and the intensity up to warm it up, but the gauge, is the gauge...
No, it's good. It's just not going to turn up the intensity until it's on tissue.
Until it's down.
Yeah.
Okay, and then it's gonna let me go with it.
Yes, but it'll warm up even with the intensity down because the machine will warm up. The coals
Okay.
will warm up.
All right. I seen it start lighting up in there, but I was like, it's not moving.
So I learned my first year back to put 2 new fuses in it and then realized it had to be on the body to turn up the intensity.
Okay, that makes sense. Yeah. So that's why it was only like going up a little bit. I thought it was broke, y'all. He's older than me. All right. So we're just adding in a few more contraindications this week. Didn't y'all had like a acronym for this on the board, so you might have to just add in a couple more on that one. No, I thought I seen one on the board. That was something else. Y'all might need to make one. Y'all just, some of y'all should just one of those. Alright, so I've explained to her the procedure. She knows what it's going to feel like. She knows she's going to get a deep warmth. It's depending on her. It shouldn't burn. It shouldn't hurt. It shouldn't make her uncomfortable. All right. Now, Miss Libby, we're going to get you laid on your belly, and we're going to remove any metal out of the area. So any piercings in the lower area. Oh, and listen, if you're working on like the ankle or the gastrocs, like have them take their shoes off. You need to look and see. You can have them take their shoes, and I probably ain't gonna take my shoes and my socks off for y'all, but all right. So we're gonna put this under your belly right here. We want a little flat belly. All right, I'm gonna roll your shirt up. Okay, I need a check. Y'all right there. Y'all go grab me some towels. You want me to come to the other side so you're not. We're just gonna drape her real quick, and that should, yeah, all right. Alright, Libby, I'm gonna pull your shirt up, okay?
Okay.
Alright, now I'm going to pull your pants down. I'm gonna tuck this in there and just kind of give it a little pull down so I can see the area. Alright. So now I'm checking. Can you tell me, does it hurt when I'm to the touch?
Yeah, a little bit right there.
A little bit here? Okay, not so much up this way. And this side?
That sounds fine.
This side's fine, so it's more located over here. Okay. So now I know where my treatment area needs to be. And if I don't palpate and I don't touch, then I might treat her right here in the middle, and then she's not going to get the full effects of the treatment. So we got to be touching. We're looking for signs of inflammation, all the things. Alright. So now that I got her mummified in her towels, we'll bring the drum over. Oh, I can feel it heating up now, y'all. Good. All right. I'm gonna pull this down just a little bit more, Libby. You are covered though, okay? All right. How does that feel? Well, I mean, like, I know you can't feel the heat yet, but it's not too much pressure on you? No? Okay. All right, so now we're gonna turn it up. Can you feel the warmth? You can? Keep going, or is that good?
That's fine, or you can keep on going.
Let's see where we're at, Libby. We're gonna go up a few more and you let me know.
You can still keep on going.
What's that?
I said you can still keep going.
All right. How's that?
That's good.
All right. So now we have her on this deep heat. We need to remind her to relax and let the machine do all the work. She doesn't have anything that she's doing right now. We don't need her to work at all. We just need her to enjoy the heat. Call button. We're coming back in 5 minutes to check. Okay, it's been 5 minutes. We're gonna come back. All right, Libby, I'm just gonna take a quick look real quick just to make sure that we're not having any reactions to the treatment. Pull it away. We're gonna look, we're dabbing to make sure we're wiping up any perspiration. We're looking. And what could we expect though?
Redness.
Pink skin, it should be warm. Her skin is already warm. Is it getting warm fast, Libby? It is. All right, I'm fixing to put it back down on there. And then we're going to turn the intensity back up again. So where we were, was that nice and warm, or?
That's
Okay.
good.
We'll go back to where we were. And then end of the treatment. We'll come back in. We'll turn it all the way back down. All right, Libby, how was that?
Fantastic.
All right, so we're checking pain scale again here. All right, we want to compare that if pain is what we're treating for sure. And we didn't check it before, but you know. So y'all, that's literally all there is to it.